First of all, I would like to thank Dr. Muhammad Al-Burai for this wonderful training course. And of course, I would like to thank my Qasr Al-Ainy professors and colleagues for this wonderful conference as usual. I am Dr. Amr Abo El-Magd, lecturer of gastroenterology and hepatology, Armed Forces College of Medicine. Of course, diagnosis of pancreatic cystic lesions is challenging process, and to get a differential diagnosis, it's considered as a complicated puzzle. We may use tissue acquisition, clinical data and epidemiology of the lesion is very crucial. Added on radiology and laboratory investigation is also important, either using radiology, endoscopic ultrasound, or cystic fluid analysis. AUS-FNA of cystic fluid is not a routine test, and all guidelines and consensus suggesting that you are not allowed to do AUS-FNA of cystic lesion unless your diagnosis is unclear or your management will alter. So, in the recent year, there have been many attempts to improve tissue acquisition in pancreatic cystic lesion with many different devices in order to obtain an adequate specimen to be analyzed. Tissue acquisition is not only useful in discriminating between various types of pancreatic cysts, but also fundamental in assessing the grade of dysplasia. So, what we already have, cytology of cystic fluid, currently the most widely performed for the diagnosis of pancreatic cystic lesion. But unfortunately, the sensitivity or the yield of diagnosis is about 66%. So, to overcome the problem of the low adequate of cytology of cystic fluid, a better target for tissue acquisition appeared to be the cystic wall. So, our recent target is a cystic wall. So, the recent device is a MRI forceps or small microforceps getting through the EUS needle. As you said, this is the needle of EUS, and you can see small microforceps inside the needle. The jaw, it's open for about 4.3 millimeter. It's better to use it to obtain a histological sample. This sample could improve the diagnostic yield and makes diagnosis easier even for non-expert cytopathologists. The technique is very easy. Under endoscopic ultrasound, you can see clearly your lesion, cystic lesion, and you're targeting small nodule inside the cystic lesion. You're puncturing the cyst with 19 gauge needle, then insert the microforceps inside the needle to obtain the tissue acquisition from the cystic wall itself. Take home message. Many steps was taken forward for the diagnosis of pancreatic cystic lesion and stratification of malignancy. Also, benign pancreatic cystic lesions are still longer sent to surgery with all related risk of high number of complications and surgery-related mortality. So, the cystic walls have become target of several devices aimed at augmenting the probability of diagnosis of pancreatic cystic lesion. Moreover, to improve the diagnostic adequacy and facilitate the diagnosis, even in the absence of pathologists, particularly expert in cytology and the pancreatic pathology. The attempt is to obtain microhistological sample. At this moment, EOS through needle biopsy seems to be one of promising technique of tissue acquisition for this challenging lesion. And thank you for current attention.